If you have been diagnosed with Graves' disease, want to avoid taking medication if at all possible, and don't even want to consider treating your condition with radioactive iodine, then the information you're about to view can be life-changing. I am a licensed healthcare professional and was personally diagnosed with Graves' disease. Knowing that this is a serious autoimmune thyroid condition, I honestly wasn't sure if I would rely on natural treatment methods, even though I without question have a natural mindset. The problem is that Graves' disease can be life-threatening if the symptoms are not controlled, and as a result, I did not take my high pulse rate and palpitations lightly. I did consider receiving a combination of the conventional medical treatments and the natural treatment protocol, which I do recommend for some patients. But although my pulse rate was much higher than normal, it was in the mid-90s when it usually was in the mid-60s, I did not consider it to be too extreme, and thus I decided to go strictly with a natural treatment protocol and not take any prescription medication. As for radioactive iodine, this is something I plan to avoid at all costs. In my opinion, this harsh treatment method should be used only as a last resort, as most people who choose this treatment method will become hypothyroid. Even when someone with Graves' disease has an extremely high pulse rate, radioactive iodine usually isn't needed to control the symptoms, as taking a beta blocker will usually accomplish this. Of course, there are exceptions to this rule, and there are some circumstances when receiving radioactive iodine is necessary. It's truly amazing how many different conditions people try to treat naturally on their own. They simply do some research on the internet, find out what nutritional supplements and or herbs might be able to help, and then visit their local health food store and purchase these supplements. For some conditions, this isn't a problem, but for a serious autoimmune condition such as Graves' disease, this is definitely not recommended. You should either be under the care of an endocrinologist, a competent natural doctor, or in some cases, both types of healthcare professionals. As for whether you should take the prescribed medication, which usually consists of a drug like methimazole and or a beta blocker, this obviously is something that only you can decide. Obviously, an endocrinologist or general practitioner that prescribes these drugs will think that a conventional protocol is the best option, which in some cases it might be. On the other hand, a holistic doctor will oftentimes think that a natural treatment protocol will be the best option for treating this condition. Your best bet is to speak with both types of healthcare professionals, gather as much information as you can, and then make an informed decision on your own. While I'm not at all opposed to a patient taking the prescription drugs, what you do need to keep in mind is that these medications are not getting to the underlying cause of the disorder. So while taking them in the short term to manage the symptoms might not be a bad idea, you also need to consider the potential consequences of taking these drugs for a long period of time. I personally can't tell a patient to stop taking a medication, but if I was in a situation where I had extreme symptoms, I would have probably taken a beta blocker to control the symptoms for a month or two, mainly the high pulse rate and palpitations, along with following the natural treatment protocol, and then would have weaned myself off of the medication and evaluate my symptoms. Because the fact remains that there are natural remedies that will help control the symptoms while you are trying to restore your overall health. For example, one of the herbal remedies I took that helped with my symptoms was bugleweed, which is for people with hyperthyroidism. Motherwort is another herbal remedy that can help with the symptoms of Graves' disease. Now, once again, I'm not suggesting that anyone with a high pulse rate and palpitations replace their medication with these herbal remedies. Although these remedies are powerful, everybody's condition is different, which is why you should really consult with a competent healthcare professional. While Graves' disease is oftentimes labeled as being a thyroid disorder, one can't forget that the immune system is affected, and it is therefore important to address the immune system component. In fact, one can argue that the immune system component should be addressed before focusing on the thyroid gland, and in some cases, strengthening the immune system alone can restore someone's health back to normal. Echinacea and selenium are just two examples of supplements that can help strengthen the immune system. The adrenal glands are usually affected too, and therefore should also be evaluated. Since most medical doctors don't properly evaluate the adrenals, and most won't attempt to evaluate this area at all, I ordered an adrenal stress index test for myself, which is a saliva-based test that measures the cortisol levels at different times of the day. Of course, the quality of the supplements taken are important. You need to be careful, as while there are some great nutritional supplement companies out there, many companies produce low quality products. Even some of those sold in health food stores aren't of the best quality. I have tried products from many different companies, and some of the best products I have used on myself and on patients are produced by a company called Standard Process, as they have been producing quality supplements for many years. I don't want to give you the impression that taking nutritional supplements and herbal remedies alone will be enough to restore your health back to normal. There are actually 5 main factors to help aid in the recovery process for someone that has an autoimmune thyroid disorder. These include: 1, having a good attitude; 2nd, proper nutrition; a third one is getting ample sleep; a fourth factor is regular exercise; and a fifth and final factor is doing a good job of managing stress. All of these are important if you want to use natural treatment methods to restore the function of your thyroid gland back to normal, assuming that this is possible. And while I have spoken about symptoms such as having a high pulse rate and palpitations, there are of course other symptoms that are common with Graves' disease. In addition to the high pulse rate and palpitations, I personally experienced weight loss, increased appetite, and shakiness. Upon beginning the natural treatment protocol, it wasn't too long before I noticed my pulse rate and the palpitations decreasing, as well as the shakiness. Now, the last symptom to disappear for me was the increased appetite, as after a few months I had a regular pulse rate, no palpitations or shakiness, and I was gaining weight, but I still had a voracious appetite. But eventually this symptom disappeared too, and along with not having any more symptoms, it was of course great to see the blood test confirm that I no longer was hyperthyroid. These are of course just some of the symptoms associated with Graves' disease, but there are other symptoms I haven't listed here. As for whether natural treatment methods can help with your autoimmune thyroid disorder, just keep in mind that everyone is different, which of course means that not everyone will be an ideal candidate to receive these natural treatment methods. Some people will need to take medicine, while others will benefit from a combination of both conventional and natural treatment protocols. I will conclude this presentation by suggesting that anyone that has been diagnosed with Graves' disease should at least consider speaking with a competent natural doctor, especially before you consider getting treated with radioactive iodine. But even if your endocrinologist or general practitioner is conservative like mine was and recommends methimazole and a beta blocker, keep in mind that these prescription drugs won't do anything to restore your health back to normal. So while they might do a great job of managing the symptoms, they will usually leave the immune system in a weakened state, leaving you more susceptible to other autoimmune conditions in the future. And just remember that consulting with a natural doctor doesn't mean that you'll be forced to choose a natural treatment protocol, but will simply give you more valuable information to help you make an informed decision so you won't have any regrets in the future. For more information on how to treat Graves' disease naturally, please visit naturalendocrinesolutions.com, where you can get a free guide entitled The 6 Steps on How to Treat Graves' Disease and Hashimoto's Thyroiditis Through Natural Methods. This guide contains 100% pure content and is not a sales pitch for any product or service. Thanks for watching this presentation, and best of luck with everything.